Okay, hi everyone. So this is an audio accompaniment to the support slides I've put up for assessment 1. So assessment 1 is the infectious disease essay. And what I essentially want to do is go through the support slides I've put up one by one. So while you're listening to this, ideally you should have that PowerPoint presentation open, because I'm going to be referencing the slides a lot and referencing the information I've put on those slides. So if you go on to the second slide where I'm talking about essay structure, I've essentially listed the sections that I'd expect to see in the essay. So we'd start off with the introduction, then a section about pathogenesis and epidemiology, then diagnosis, then treatment, then we'd have the discussion, and kind of tagged onto the end of that discussion we'd have a future work section, then we'd have a conclusion. So what I'm going to do as we're working through these slides is talk about each of these sections in a little bit more depth, talk about what I'd expect to see in these sections, and just give you some general advice about what you should include in those sections. First, just a quick point on this essay structure. Your essay doesn't have to fit this structure exactly. This structure is a guide, it's advice. All you actually need to do in terms of meeting the brief is meet the kind of PDF I've already put on the module space. So if you look at that, I'll basically say, it basically says, I'll bring it up now, it says the information that you need to include. So I'm just getting that document up. So what that brief says is you need to include pathogenesis, epidemiology, diagnosis, treatment, and recent research developments. So that's what you're actually being marked on. That's the actual assessment brief. The information in the slides is more advice on how to meet that brief. So you don't have to follow the structure I've laid out. However, it would be a good idea, just as long as you have the pathogenesis somewhere and the epidemiology somewhere and the diagnosis somewhere and the treatment somewhere, and as long as you have recent research developments somewhere, then you're still meeting the brief. This structure is just one way that you can meet the brief, and I think it's good advice to follow this structure. You'll note that one section that's missing is research developments. So the research developments should be included in all of these sections, and particularly the discussion. So when we're talking about recent research developments, we don't have a distinct section for it. However, when you're talking about diagnosis, you should be talking about the recent research developments relevant to diagnosis. Same for treatment. And then for discussion, you're kind of tying everything together. So you should be talking about research developments in all of these sections, really. Okay, so I'll go through each of the sections one by one and just talk about what we'd expect. So if you go on to the next slide, I'm talking about the introduction. So the introduction is essentially all the background information a reader would need to understand the rest of the essay. So it's the same as a background, really. It should be reasonably short. You don't want to dwell on the introduction for too long. The reason is because the introduction is going to be largely descriptive. And you don't get high marks for descriptive work. So the introduction isn't where you're going to earn the high marks. It isn't where you're going to kind of show that you're a 70 plus student. It's just where you're giving the background that's necessary for the later sections. In the later sections, that's where you're going to be kind of discussing things and coming up with original ideas and putting forward kind of insightful analyses. But the introduction is really just descriptive. You're just giving an overview of the area. You're talking about the context of your infectious disease, and you're talking about why the essay is focusing on this infectious disease. Why is it important? Why should we care about it? You're talking about kind of relevant issues that aren't maybe strictly, you wouldn't think of them as being strictly relevant to infectious disease, but they are relevant in the context of your infectious disease. So things like maybe there's a war going on in the country where your infectious disease is, issues to do with poverty, anything like that. any kind of cultural issues as well. Yeah, so again, this section should be concise, so you don't want to be going into too much detail. It's just going to be a clear, kind of brief account of the infectious disease from a kind of broad perspective, and given all the information we need to understand the rest of the essay. So if we go on to the main body section, so this is the next slide. So again, these sections are going to be primarily descriptive. So for the pathogenesis, you're going to be describing the pathogenesis of the disease. You're going to be saying how the infectious agent causes the disease, and you're going to be doing this at a molecular level. So because you're level 6 now, you should have some understanding of biochemistry and cell biology and things like that, anatomy and physiology. So you should be able to take your infectious disease and show an understanding of how the infectious agent is actually causing pathology. So one example we talked about in the lectures was HIV, and we say that HIV causes disease by entering into immune cells and destroying those immune cells, so the individual ultimately ends up with low numbers of immune cells, so their immune system essentially stops functioning, so they're immunodeficient, and that's what AIDS is. And so that's the pathogenesis of HIV infection. Obviously you want to say it a bit more clearly than I just did. You want to go into a bit more detail, you need references and things like that, but you'll see how it's primarily descriptive. What you're essentially doing in each of these sections is demonstrating your ability to communicate scientific information. So again, no real original insights are needed. You're not going to be discussing too much. You're not going to be adding too many of your own points of analysis. It's just a description of the literature. It's just a description of the diagnostic tools used, or the treatments used, or a description of the epidemiology. You're just telling me the facts of the matter. One part in each of these sections where you do need to show some kind of ability to go beyond descriptive is when you're identifying specific issues. So if you're talking about a diagnostic technique and there's problems with that diagnostic technique, this is where you can tell me about it. So again, it's a bit beyond the description that you're doing in the introduction, but not far beyond, because you're going to be referencing papers for it, and you're just going to be telling me this diagnostic technique only works 80% of the time, or it only works if the infectious disease is established, or it's an expensive technique. So these are not really original insights, but it's a step beyond the description that you're doing in the introduction. And again, these sections aren't going to be overly lengthy, because what you really want to do is get into the discussion, because the discussion is where you're going to be hopefully earning the high marks. Okay, so for the discussion, we're going to be moving away from the descriptive. So all the descriptive information you need is going to be primarily in the introduction and in those individual sections. In the discussion, you're going to be discussing that information. Crucially, you're going to be talking about those problems that you alluded to in the earlier sections, and you're going to be going into a lot more detail, and you're going to be offering solutions. And again, these solutions don't have to be, we don't expect you to solve any of these problems definitively, because a lot of the times you can't. These are complex issues. But what you can do is make insightful, original suggestions that are based in the science, that are based in the literature. So if your infectious disease is Ebola, and in the kind of diagnosis section, you've told me there's a problem with the diagnostic tools being used, then in the discussion, you can talk about why that problem exists, why it's so hard to solve. You can make parallels with other infectious disease. So talk about how we diagnose HIV. Is there a parallel there? Could we use a similar method to diagnose Ebola? Same for treatments. So if you're telling me there are no real effective treatments for Ebola, what about the infectious diseases we do have effective treatments for? What about the treatments we have for HIV? Can we use those for Ebola? Same for swine flu and bird flu and all these different infectious diseases. So again, you're going beyond the descriptive. You're thinking about the issues that you've identified in the earlier sections, and you're really taking it to the next level. You're trying to come up with solutions for these issues, or if you can't come up with solutions, you're at the very least discussing these issues in a detailed way, and you really getting into detail and really understanding the nuance behind the situations and behind these problems. So on this slide, I've said this section should be critical and evaluative, and that's right. So what I'm talking about there is being critical, being evaluative, evaluating the situation, being critical of things like, so if we're talking about an infectious disease that may be spread through the population rapidly, we can be critical of how governments have responded to it, how charities have responded to it. We can be critical of individuals, in kind of the response to the infectious disease on an individual level. Maybe people haven't been eager to take necessary precautions, and we can evaluate that and then come up with solutions. It should not be descriptive. So you do need to be accessing the wider literature. So again, just because it's not descriptive, you still need to be referencing things. Obviously, if they're your own ideas, there's nowhere to reference because it's your own idea. But you need to reference papers that your ideas are based on. So as I said, maybe parallels in other infectious diseases. Okay, so the discussion will flow into the future work section. Now this is a really key section. So it's kind of separate from the discussion, but it's kind of you can kind of consider it the last part of the discussion if you want. So basically you need to be identifying specific opportunities for future work. So you've told me that there's a problem with the drugs used to treat this infectious disease, and you've given me some ideas of avenues we could explore to come up with new drugs or to come up with vaccines, and you've explored the barriers that are in the way that are preventing vaccine development and preventing drug development, and you've discussed ideas to overcome these barriers. What you need to do now is discuss specific clear ways into which those ideas can be put into practice. So one of the worst things we'll see is when students will work their way through the whole essay and they'll get down to this future work part, and they'll end up just putting a generic statement like future work is needed in the area, or these ideas need to be explored further. That's a really weak statement. There's not a lot of value in that statement. You need to be making specific suggestions. So I don't expect a study design or a methodology, but I expect certainly a lot more specificity than just a vague open statement. So suggest a clinical trial, suggest a specific drug that we could do safety trials in, suggest a specific program that we could funnel funding towards, or suggest a specific public health measure that could be tested, suggest how that would be tested, what population, for what length. So again, this is these are level 6 concepts, so we're not at level 4 or level 5 anymore. We really want to be specific, and we really want to be insightful, and we want to be kind of demonstrating our ability to be intelligent. Okay, so the conclusion, obviously this is the final couple of paragraphs. This is going to be short, just a few hundred words. I think I mentioned in terms of length, you want the discussion and the future work section to be that's where you're allocating most of the word count. So if you think of your word count as resources, and you want to allocate most of those towards the discussion and the future work, because that's where you can show off, if you like. That's where you can show your ability to discuss and evaluate and things like that. And back to the conclusion. So yeah, it should be reasonably short, just a few hundred words. So the idea is that the conclusion is clear, specific, and accurate. So you're basically giving an overview of the points you've made throughout the essay. one thing you need to do as well is kind of be critical of your own work, if that makes sense. So you need to discuss the limitations of the essay as well, because obviously it's not going to be a perfect essay. There's going to be issues that you can talk about. It could be limited access to papers. It could be limited. It could be a fact that not many papers exist. So perhaps you're talking about clinical trials of a specific drug, and there's only 2 clinical trials available, and you've based a lot of your arguments on the fact that this drug works in these 2 clinical trials. Well, you need to talk about the fact that there's only 2 clinical trials here. You need to say that in a very succinct way. And the final, so you can also do that in your discussion, by the way. So that's a form of evaluation. It's a form of discussion. And at the end of the conclusion, you want to end with what we call a single strong concluding statement. So a lot of times when people pick up a research paper or pick up an essay, one of the first things they'll read is actually the last sentence. A lot of the time they'll read the conclusion. That's why we keep it quite short. But also a lot of the time they won't even read the conclusion. They'll just read that last sentence. So make sure your last concluding statement is clear, concise, and that it's kind of powerful, and that it summarizes your essay in some way. Okay, that's everything. So I hope that makes sense. As I said in the taught day, I can accept drafts. That's fine. So if you can each send me a formative draft, that's kind of a good opportunity. If it was a bigger module, so obviously there's modules where I have, a lot more students, and on level 4 modules we'll have hundreds of students, and there's no way we can look at individual drafts. So I take advantage of the fact that because of your module size, I am able to look at individual drafts. So I'd encourage you to send a submission.